Welcome to the Neurology Nuts and Bolts podcast, all about constructing your career in neurology. I'm your host, Sagari Betté, from the Parkinson's Disease and Movement Disorders Center of Boca Raton. And today, as part of the Types of Careers series, I will be speaking with Lindsay Dudeck, a pediatric neurologist with Northern Light Healthcare in Maine, about locums. Thank you for joining me today, Lindsay.
Thank you for having me, Sagari.
So first and foremost, I think we need to address the big question, what are locums or locum tenens?
So the term actually means to stand in for or something along those lines. And in medicine, it refers to having a sort of temporary placement where there's a need for a particular type of doctor.
And how did you find out about available locums positions, and how did you decide that that was something that you wanted to pursue?
Well, it actually came out of necessity for me. So shortly after fellowship, I was in the process of finding a job in academic medicine, and I had gone through the process and had a couple of interviews at a particular institution, and it was my plan to work there. I had a personal situation come up with my marriage in that it ended rather suddenly and emotionally traumatically, and I kind of just had to make a new plan. I was no longer going to stay in the area that I had been planning on working in, and I was no longer going to take the job that I had been planning for. So I was just kind of left with this moment of upheaval in my life, and with my student loans coming due in a few months. And I ended up just responding to one of the locums recruitment emails, which if you guys haven't gotten them yet, I'm sure you will soon. And I signed up to work for a locums company. And at that point in my life, the benefit was really that this wasn't a huge commitment. It wasn't like signing a 3-year contract or moving to a place where I was planning to be for the next several years. It was just sort of a temporary way to get some income and to start my career. And when I first started, I didn't intend on staying for very long. I thought, well, maybe like 6 months to a year, and I'll just sort of figure out what my next steps are. But I ended up actually really liking it, and I did it for about 3 years.
And were those 3 years spent in very different locations? And did you have a choice over where you actually went to work?
Yes. So, well, first, the first answer to the first question is no, they were both in Illinois, which was not a place that I particularly chose. It was just the first job that came available. So I worked in Springfield, Illinois for a hospital for about 9 or 10 months, where they just only had sort of one pediatric neurologist in the area, and they felt they needed another to help cover, call at the hospital and to give access to their patients. And they ended up canceling the contract about 9 or 10 months in because they felt locums was a little bit too expensive. And they actually offered me a permanent job, but I didn't really want to stay there. I didn't love it enough to commit to it. So I said, you know what? No, I'm just going to go on and find a different job. And then once you're licensed in one state, it's so much easier to get another job in that state. So there happened to be another opening also in Illinois, but in Rockford, Illinois. And so I went there where, again, it was a similar situation where they just didn't have enough neurologists there for kids. And so they were looking for somebody to be there on a semi-regular basis. And I ended up really liking it there and staying for about 2.5 years. And they also offered me a job there permanently, but it wasn't like I particularly chose Illinois or that I loved the town I was in or that I had another reason to be there other than the job. So I didn't want to stay there. But the jobs I had there were 2 weeks on, 2 weeks off. So I would fly into either Springfield or Rockford, and I would stay for about 2 weeks taking call and working in the clinic and working in the hospital. And then after those 2 weeks were over, I would fly home, and then I was off for 2 weeks out of the month.
Is the length of a locum's position determined before you take that position?
There's a little bit of give and take. The hospital will tell you, what it is they're looking for in terms of their expectation, and you can tell them what you're willing to do in terms of time commitment, and then you see if it matches up. So these hospitals wanted somebody to do, 2 weeks of coverage and 2 weeks of outpatient clinic per month. And I was fine with that. So that was what was agreed upon. And that was sort of how my contract was written. In general, specialties like neurology, they probably would want a doctor to be there at least for a week at a time for coverage. Other specialties like, ER or surgery or OBGYN, they might be willing to do more of like a weekend coverage. But in general, for neurologists, they want you to be there 1 to 3 weeks a month, or sometimes for like a several month stint if somebody's going to be out.
Who covered the cost of your relocation, or when you say that you would fly home for 2 weeks, the cost of your flight and the cost of accommodation?
So the Locums company does. So the Locums companies are essentially headhunters. So, like I said, you guys will get emails from Locums companies, or sometimes they'll even just cold call you. But the company has a deal with the hospital where they're providing them with doctors to cover their needs, and they're kind of just taking a cut of the profit that's made by the doctor being there. And so they're responsible for not only negotiating the contract, but they're also responsible for taking care of your accommodations. And because they are making a profit off of you, it often felt like you were being treated very well, and they would like do things to make you want to work with them. So they paid for all of my flights. They arranged for my rental car, for my accommodations. If you have some unexpected expense come up, like I know if I had like a family need where it was like, oh, I need my mom to come out for this weekend, like they would have actually paid for her flight to come to one time. And I think they do that for people who have spouses that want to travel. Sometimes that can be part of the deal, because they are making a good amount of money off of you. So they take care of all of that. And they also take care of all of the licensing, credentialing paperwork, which if you have ever gone through that, it is a massive headache. And they kind of take all of the headache out of it. And there's just a limited amount of paperwork really that, you have to answer those questions that like, no, you're not a criminal. And, no, I don't have any dings on my license. But they do most of the paperwork for you and then just kind of shuffle it between you and the institution. So it takes a lot of the headache out, and they do financially pay for all of your accommodations.
And do you get a choice in that accommodation?
You can express a preference. Some people do like Airbnbs. Some people have hotel rooms. Like I always had a hotel suite. So it had like a little kitchenette and a little living room and a bedroom. But I mean, I could have asked for like, an Airbnb. I'm sure they have some cap on whatever cost they're willing to pay for your accommodation, but you do have a choice.
Who provides the malpractice coverage in these positions?
The Locums company does. And it was pretty good. It was definitely up to, I think, $1 or $2 million. They provide tail coverage, and they also take care of all of the paperwork for that.
What about health care, health insurance?
So that I would say that's probably the biggest downside. There is no health insurance. You have to pay for it yourself through like privately, or, get it through your spouse or something else.
How did you choose to handle that?
So when I was going through my divorce, I actually was still on my ex-husband's health insurance for a while. And so I was able to use that and then just extend it through Cobra for a while. And then, divorce takes a long, you're separated and then you're divorced. So that actually took us almost through the whole like 2.5, 3 years that I did it.
What have you observed other physicians who take locums positions to do with their health insurance?
So I think there are some locums companies now that are trying to arrange a way to give their physicians health insurance, but you could either pay for it privately or have it through your spouse. I wasn't particularly worried about that because I made enough money doing locums that paying for my own private health insurance would not have been a problem. Between doing locums and I subsequently did take an academic position, I made so much more money doing locums that I could have just paid for my insurance if I had to. And I would have still been making more money than I made at my academic job.
You've mentioned the emails several times that all of us get from these companies. Are there certain companies that are more reputable or reliable than others? And how do you go about figuring that out?
As far as different companies, I would say probably the big names like Weatherby or Comp Health might have a little bit more clout, but I think it really comes down to the individual recruiter. So recruitment actually is a very profitable field. Some good recruiters make way more money than physicians do. And so you will find some that are very money driven and kind of want to not take advantage of you, because in whatever situation, you're going to benefit, you're going to be paid a decent amount of money. But there are some that will try to they'll try to optimize their profit at your expense, and others that will be just honest and this is a mutually beneficial thing for us. So for instance, when I was first looking at locums jobs, I had talked to a couple different companies, and it was if you look at the emails, they're very vague initially about where the location is. And the reason is they don't want to reveal the name of a hospital that needs coverage, because then you could theoretically just circumvent them and go make a deal with that hospital. So they usually want to get your CV before they'll tell you specifically where the location is. And so I had talked to a couple different companies about a job in Massachusetts, and one of them was quoting me I think it was $1,400 a day, and another was quoting me $900 a day. And it actually was Weatherby that was quoting me $900 a day. And because I was so new to this, I actually thought it was a different job. I was like, oh, cool, there's two different jobs, locums jobs available in Massachusetts. But what I realized afterwards was that the guy from Weatherby was actually going to shortchange me on what they were willing to pay me and take the profit himself. So I think, there are people who will do that, but what's a good idea if you're going to do it is to kind of check around with your colleagues or go online with these, doctor Facebook groups and find out what the going rate per day is for your specialty and see what other people have gotten. And then just don't settle for something that's significantly less than that.
So in that sense, it's less company specific and more so the individual recruiter who is determining what the upfront offer is for any particular position.
Yeah, I think the honesty and integrity of it probably comes down to the individual person. And then they're obviously representing their company in terms of what margin they're willing to take. And I think in that case, maybe some of the newer companies, the smaller locums companies, would maybe be better because they're not as established. They don't have as many people working. They might be, more willing to work with you if you ask for more money. But I would say you should always ask for more money because they probably have a little bit extra that they could give you from their profit margin.
Apart from the salary, are there other areas that are low-hanging fruit to negotiate when you're negotiating a locums position?
One of the perks of locums for me, besides the money, was the lifestyle. So, the company I worked for did not care where they were flying me to. And they would fly me anywhere within the continental US to and from my assignments. So I would finish my assignment and be like, okay, I need a ticket to New York. And then from that flight to New York, I would hop on a plane and go to Portugal or go to Ireland or take my trip to Sri Lanka. I did a ton of traveling those years. And at least one leg of the journey was paid for by the company I worked for. And one of the other benefits is that, because you're needed at these hospitals, the scheduling can be up to you in a lot of ways. So, I did a lot of traveling and I did some medical volunteer work where I basically arranged with the hospital that I wanted to be off for 7 weeks so I could go to Zambia and work and then have a little time off afterwards. And they were willing to accommodate that. So they just kind of stacked my 2 weeks at the beginning and end of a month. And then I had a big gap and then another stack of a couple of weeks. And so you have a lot of flexibility in that way that you definitely would not have with a regular job.
Overall, compared to an academic position, which I know you've also held that type of position, do you think that a locums position is in some way more busy or grueling or demanding of you when you're actually working? Or is that a misconception?
I felt like my academic job was by far more grueling and more tedious. The hospitals that I worked at for locums were smaller community hospitals, right? Because those are the hospitals that have need. It's not like some big academic center needs multiple more people to cover. And so in general, the inpatient service was smaller, less acute, I would say. And the clinic there wasn't anybody kind of like complaining to me about my productivity, right? Like they wanted me there to help them see patients and they were kind of happy to have me doing that. It wasn't this constant like, well, why aren't you doing more? You need to have another clinic like it is in academic medicine. And so I felt like my day had a nice pace. I mean, it was busy. I would, go into the office at 8 and see patients, throughout the day and then see consults at the hospital either on my lunch or immediately after. But it wasn't a super busy hospital service. So I would start work at 8. There was maybe occasions where I was working past 6, but not often. And then I was just carrying the pager, which, would go off maybe once or twice a night or sometimes not at all. And it felt honestly very sustainable. That's why I did it for years, because it felt, it felt busy, but not overwhelming. And then on the flip side, I had 2 weeks off every month to recuperate and do whatever I want. So I would say as far as burnout goes, I was not burned out. I had energy to travel and do volunteer work that I absolutely did not have when I had my academic medicine job.
Who determines your clinic schedule in locums?
So in a lot of ways you do. At both the places I worked, they asked me what my preference was in terms of, how long I had for a new patient, how long I had for a follow-up. And they were fine doing, what I've seen standardly done everywhere else. But they did ask me, and I could have said, no, I don't need that much time for everybody. Would they have gone for it if I said, I only want to see 3 patients a day? Probably not. But I felt like I was offering a reasonable number of patients and they were offering a reasonable amount of time for me to do that. But they did ask. There was a little bit of negotiation.
Before you take a position, do you know what type of support staff the position comes with, and not just in terms of administrative staff, but also medical assistants, nurses, NPs, or PAs?
Yeah, you do. So before you would be contracted with a place, you would have at least a phone interview with them that typically involves one of the administrative people and also one of the doctors working there, if there is a doctor in your specialty working there. And that's where you can ask all the detailed questions. So for me, I, always ask, well, how are the EEGs read? What would my responsibility be for that? How many are there? What is the clinic like? What is the call schedule like? Are you are you being woken up 5 times a night every night? How many patients do you have that are admitted to your service versus just doing consults on? Those kinds of questions. And certainly, how many people, help in the clinic as far as, your nurses or the MAs and just sort of how the clinic runs. But you can ask all that, it's not a big surprise. There's nothing sprung on you. If you wanted to sit there with them and ask 50 questions, you could do that.
So far, we've talked about what is really enjoyable about locums. Were there any downsides?
For me, the downsides were personal mostly. So I did get tired of flying twice a month. And part of that was because I didn't want to live where my assignment was. I certainly could have taken an apartment in Rockford, Illinois, and stayed there. That would have been fine, but I didn't want to. My family, my friends were elsewhere. So I did a lot of traveling, and that got, tiring after a while. I was also a little bit tired of feeling transient all the time. I would have an apartment, but I was kind of never there. I didn't feel like I had really put down roots anywhere. I kind of had one foot in one place and the other foot in another place, which again was the way I sort of structured it, but it got wearing after a while. And after my locums job, I did end up going back to academic medicine because I felt like I was too early in my career to be working in a community hospital without the really challenging cases. I felt like when I was there, if something crazy or interesting or unique came in, I did sometimes need to transfer it to the bigger institution that was an hour or so away, just because I was there by myself. Am I really going to start plasma exchange on somebody when there's not even anyone else to bounce the idea off of? So that was a bit of a challenge. And I definitely appreciate having colleagues. So for those interesting or challenging cases, it's nice to have somebody in your field who you can walk into their office and ask them what they think, or if there's an EEG you're looking at, ask somebody for their opinion about it. And with locums, at least in my experience, I was often the only neurologist there. So certainly I had my friends from training and my former attendings from training who I could reach out to, but it's not the same as having somebody who works in your office who is there all the time.
Either professionally or socially, would you ever describe locums as lonely?
No, I really loved doing locums. And I know I said I went back to academic medicine, but I also left academic medicine again because I felt like it wasn't what I wanted. But it might also just be my personality. I really enjoyed the independence and the freedom. And in a lot of ways, it gave me the opportunity to keep up with all of these friends that I normally wouldn't see. It's easy when you're already somewhere and you're already going to be flying out and you have a week off to call up your best friend from college and say, hey, can I come visit you? And they're like, sure. And then you just book your flight there and you get to be with them. Or flying to see my parents, which I did quite often. And my dad had an accident and had to have surgery. And I was able to be there for him and my mom so much during that period of time. I would go to work and then I would fly back home to be with them. And I would go back to work and then fly back home to be with them. So I think I did maintain a lot of connections with my family and friends that I probably wouldn't have if I had just had that permanent job somewhere else that wasn't near them.
Do you think that experience is reflective of other people who take locums positions?
I think locums tends to draw people who are either having an upheaval in their life where they're kind of not sure what they want to do, or maybe people who struggle in very structured environments. I know there were some locums people that I met that seemed like they had an awful lot of personality conflicts with wherever their permanent job was, and therefore just did better having these temporary placements. But I don't think it has to be like that. I don't consider myself to be one of those people. I tend to get along with everybody. The places I've worked were happy to have me. Like I said, they would have offered me a permanent job. And I think that can be true of anybody. If you want to try that out, it's a great opportunity and you might find that you really like it. But I think that there is this sort of stigma in medicine about locums, like it's only people who can't get a job somewhere else, or it's people that have some sort of issue or blemish on their CV. But it does not have to be that way at all. You can just be tired of the rat race of clinical and academic medicine and decide, I just want to do something for myself. You can be a phenomenal doctor and just decide you're going to switch gears. And there are people like that also. And I think that stigma is changing a little bit now that people are a little more open-minded in general about different kinds of careers. I think that's changing.
How feasible do you think it is for someone to take a locums position if they do have strong roots in a particular area, meaning perhaps they have a spouse and children who are attending school, but they might fit into that category you're describing where their current position is not providing professional satisfaction for them and they're considering locums? Would it be something that they could reasonably do while maintaining their home and family elsewhere?
I think it would probably depend on how old their children are and what kind of work the spouse does or whoever takes care of the kids normally does. I think for at least the friends I have who are young moms with little children, I think it would probably be really hard for them to be away for a week at a time. But if you had older children maybe and a spouse that could kind of shuttle them to and from their things throughout a 1 week period when you're gone, then you come home and you have 3 straight weeks off where you're not missing a soccer game and you get to be there all the time. So there is that flip side too. Yes, you're gone a week a month, but then the rest of the time is actually your own free time. You're not beholden to anybody.
You've mentioned before about the finances of locums. Overall, do you think there's really a financial advantage to locums? Because when I see these emails, I'm always thinking in the back of my mind, is this a marketing tactic? Are they trying to sucker me into something?
I think there is a financial benefit. So just to be completely blunt, and maybe it's crude to talk numbers, but my last couple years, I made about 230,000 a year, and that was working 13 days a month. So if you translate that into, a full-time job, I mean, that's a lot more money than I think what a standard salary is for most neurologists.
And how do you handle, or how does the locums company handle taxes?
So you are what's called a 1099 employee, which means that no taxes are withheld from your paycheck. So you have to not spend all your money, and then you will end up paying quarterly payments to the government, which I just had an accountant who, we anticipated what I was going to make for the year, and he gave me these little stubs that are like, okay, you owe $10,000 in September and June and whatnot. And I just paid that way. And then at the end of the year, maybe I owed a little more, or they owed me something, but you do have to at least take care of that yourself. From a tax benefit perspective, being a 1099 employee, you're allowed to use what's called a SEP IRA, which means that you can put in a certain amount of cash into that is then it's like deducted from your taxable income. And that was a number that my accountant would figure out for me, and it was usually around 35,000 per year.
Currently, you're not in a locums position. Do you think you would go back to doing locums at some point?
Absolutely. Yes. I love my job now. I'm living in Bangor, Maine, and I love the hospital I work for. And I picked this job because I really wanted to be closer to my family. Like I said, I did a lot of traveling and was just sort of getting tired of being transitory all the time. So I wanted to buy a house and sort of have that settled feeling. And so I live nearby where my family lives. And, I'm in a relationship where now we live together and we're together all the time. And there is, the benefit to doing that. But I could definitely see at some point in the future going back to, 1 or 2 weeks a month and then having, a very luxurious amount of time off.
What else do you think that trainees or recent graduates should know about locums positions?
I guess I would just stress that there is really a stigma in medicine that doctors have to work all the time. When I first started doing locums, I would be chatting with people I met about what my job was. And I would say, I work 2 weeks on, 2 weeks off. And every non-physician I met was like, wow, that is a dream job. That is amazing. And every physician I met would be like, well, where do you work the other 2 weeks? And I think it's so striking that there exists this mentality that if you're not working 24 hours a day and burning yourself out, there's something wrong with you. And I think I would like people to know that you don't have to exist like that, and giving yourself time to be with your family or to travel or, to binge watch something on Netflix and having that peace and time to yourself actually makes you a better doctor. I had much more patience doing locums, and I had enthusiasm for doing volunteer medical work, doing locums that, when I had my academic job where I was working all the time, I didn't have that patience or that peace of mind. I just got really burned out rather quickly. And I don't think it has to be like that.
This has been very enlightening and informative. Thank you so much for joining me today, Lindsay.
You're so welcome. Thanks for having me again. I love talking to recent graduates about my experience doing this because I really loved it, and I genuinely would encourage other people to do it.
Neurology Nuts and Bolts podcast was created and produced by Sarah Schaefer. This podcast is not recorded as an official podcast of any institution or organization. The podcast is unfunded. Opinions are those of the individual participants. Music by Audrey Nath, artwork by Shivani Ghoshal. Want more content like this? Be sure to subscribe to the Neurology Nuts and Bolts podcast wherever you get your podcasts to hear more about constructing your career in neurology. Follow us on Twitter at NeuroBolts and on Facebook at Neurology Nuts and Bolts to stay up to date on new content and give us feedback on what you want to hear. And tell your friends. Thanks for joining us.